Using technology to improve patient outcomes represents a major opportunity in the healthcare sector. This week, we're going to be talking to an Ottawa company that's using technology to connect patients and their families to care providers. We'll hear from Michel Paquet, the CEO of Aetonix, this week on Techopia Live. Hello, ladies and gentlemen. Welcome to Techopia Live. I am your host, Craig Lord. We're back in the accelerator space at Invest Ottawa at Bayview Yards here, surrounded by some of the city's best startups. And no exception, our guest here is Michel Paquet from Aetonix, one of the companies incubated here at the accelerator. You're dealing with an interesting aspect of medical technology, a technology that can actually improve connections between healthcare providers, their patients, and their families to improve outcomes, to improve communication here. You've had some success in the past 5 years, including winning the Pitch Fest at TICON just last year. So, Michel, I would love to hear from you. What exactly is Aetonix doing, maybe even locally here in Ontario?
Well, first of all, thank you very much, Craig, for the opportunity. This is amazing. As you well said, we did win the TICON Canada, which was actually in November. Very exciting, very pleased about the opportunity that we had to be at the Pitch Fest. So to answer your question, so we're actually a company that focuses on simplifying complexity of home care. We developed a product called the aTouchAway. It's a mobile platform for remote complex care management. So what we do is we help healthcare professionals to really manage patients remotely through our system. So we have remote monitoring, we have telehealth, we have protocols that help them to manage the care of patients. So often we focus on chronic disease patients, people with multiple conditions, and we talk here about COPD patients, people with cancer, people that have different complex disease that we have to handle. So in Ontario, we had quite a bit of a success so far. So we've deployed with a few hospitals in Ontario. So one of those, for example, being the hospital in Napanee, which they've been actually deploying our products for supporting chronic disease patient at home. We had a great success there, Craig. So we deployed the product. They support their patients with conditions at home that are actually having breathing issues. And initially they had a readmission rate for 30 days readmission of about 23%. That means one patient every four patients were getting to be readmit. And with our products over 9 months, we reduced this to 3%. So we had a major reduction. So that was one of the stories that we give to the Pitch Fest, and that's what happened. Yeah.
Mm-hmm. And it must be very rewarding, I imagine, as an Ottawa-founded company, making a difference in Ontario, very close to home.
Yeah, it's absolutely fantastic to see that we have actually clients recognizing what we're doing. We got patients that have actually took the opportunity to write letters to our premier to explain about, what we did for changing their life. It's like we had people that literally have, either follow up of a stroke and have actually are, at home and required to actually have attention to be supported by their care coordinators. And through our products, they could do it. They could do it through a telehealth visit. They could do it by following up on their care plan actions that have been provided. So yeah, it's very rewarding, and I have to say, we're quite proud of actually having an impact like this on people's life. Yeah.
Mm-hmm. And it's not just in Ontario, though. One of the recent announcements you made last year was that you've been accepted into the Canadian Technology Accelerator, and you're working in Boston, actually, in Cambridge there, to expand into the U.S. through this accelerator. Can you talk about that experience?
Absolutely. What that's doing? Well, first of all, we're so fortunate in Canada to have the Trade Commissioner offices. The Trade Commissioner office from the federal government is a supporting company like mine to actually be in another country. In this case, we went in USA, and we're part of the CT, as you mentioned, which is the Canadian Technology Accelerator Program. So we're actually at the Cambridge office. So we're at the Cambridge Innovation Center. It's a center like here for startups and companies. So we were fortunate to be selected among 7 companies across Canada to be accelerated into this Canadian Technology Accelerator program. Now that program comes with mentorship, so we've been assigned a group of mentors. They're typically Canadians that, many years ago have decided to move to the USA for doing their own business. So in my case, I've been very fortunate to be surrounded from people from McKinsey. I got surrounded from people that have either led into an hospital from in USA. So I got a team that knows about healthcare that is helping me to understand healthcare in USA. So it's like drinking from a fire hose, really. I was there and learning about what's happening on the healthcare system in USA. So it's absolutely fantastic for a company like mine to be supported with a group like this in the USA, because they're actually following up on actions. They're helping us to actually get introductions to potential clients and potential opportunities. They're helping us to understand how the healthcare system works, which is fairly complicated and different than here. So that's been my experience has been absolutely fantastic. Mm-hmm. And the group of, not only the group of mentors, but the group of professionals that is with the trade commissioners is absolutely amazing for connecting us with investment community, for connecting us with potential clients, as I mentioned, but also potential partnerships. So this has been the experience for the last 5 months. Yeah.
Mm-hmm. That's excellent. That's excellent to hear. And you mentioned obviously getting to drink from the fire hose is how you put it, to understand what's going on in the healthcare system down in the U.S. I'm wondering what is that like? What are you seeing in that industry? Is it difficult to get in there? Is there substantial room for opportunity? What is your impression of the U.S. healthcare market right now?
So the U.S. healthcare quite different than here. Here, mainly more government related, where in the US healthcare you have a lot of private organizations that are actually focusing on supporting their patients. And innovations, although very well received here in Ontario and in Canada, is also extremely well received in the US, mainly because ROI is very important for them, return on investments. And so what I do see on the US side, for example, there's a group that I'm currently working with, which we hope to have our first potential client. In their case, it's really about reducing readmission rate at the hospitals and really increasing the outpatient scales, because if they do, they increase their revenue side. So the healthcare system is very complex in the States compared to Canada. It's a mix of private industries where you have the payers that are actually mainly the insurance companies, and you have the providers that are typically the hospitals, which map to our hospitals here, and you have some of those that are actually combined. The providers and the payers are together, and we target those groups because they're the one taking the most risk on the patient with the agreement that they have with the Medicare systems, okay. And that's who we target with. Mm-hmm.
So yeah, it's interesting to parse out what the different industries, players are, those combinations, and figuring out where your solution best fits that market, a specific that merger of the provider and the payer.
Absolutely. Just one note that I've actually see as the states taking like a bold action. In the United States, they've realized that chronic disease patients are actually something, it's one of the highest thing in terms of number of patients that are actually consuming the budget, if you want, of healthcare in the States. Same in Canada. So recently, they've actually, Medicare has published some new codes, billing codes that could be used for remote monitoring, for telehealth, that could be used by a company that would like to use a product like us to be able to support their patient at home. So they've actually made the realization that we need to support people at home, and we're going to actually have a way to support the professionals to do this by offering like a code that could be supporting those patients, when those professionals that need to support those patients at home. So the system is getting designed more about pushing or keeping people at home, mm-hmm. and really trying to create the system to be accountable for the patients to be supported at home.
Right, we hear a lot about reducing the crowding in hospitals, but if you're going to do that, making maybe that at-home care more accessible and more effective is probably a big step.
100%, yeah. For sure.
Awesome. Well, it's been fantastic, Michel, to have you here and hearing what Aetonix is doing to improve healthcare at home and even south of the border. And maybe the next time people are working in one, or visiting a loved one, maybe at one of these care homes or facilities, that maybe they'll see the aTouchAway platform and think of what you're doing here.
Thank you very much, Craig, for the opportunity. And as you well said, like I sure hope that people in Ontario, when they visit either a hospital like Napanee or Women College hospitals, and if they use our products to be able to support caring for their needs as they are at home and needing care, we'll be very proud of it. So thank you for the opportunity.
Great to hear. Thanks very much, Michel. Before we take off, I want to take a quick moment to thank some of our sponsors, without whom this show would not have been possible. I want to start with numbercrunch, offering virtual CFO services to SaaS firms. There's Perley-Robertson, Hill & McDougall, a leader in business and tech law. There's TD Bank, offering specialized services for tech firms. University of Ottawa, Faculty of Engineering, creating the next generation of technical talent. There's Stratford Managers, offering services to help you scale up your tech venture. And KRP Properties, offering so much more than just space. Of course, Techopia is not just this fantastic show. We also have daily articles on obj.ca/Techopia. You can follow us on social at Techopia OTT on Facebook and Twitter. And if you're watching us on YouTube, please leave a like and a comment and subscribe to us to see our weekly episodes. Apart from that, I just want to thank you very much for joining us, and we'll see you next week for the next episode of Techopia Live. Talk to you then. Bye.